Hi, I'm Karen and I'm autistic and ADHD, and this video lists some reasonable adjustments that can help me in environments like the doctor's, dentist, hospital, etc. So, for example, be patient and friendly, smile and use my name. Acknowledge that if I'm finding it hard to engage, that the environment or delivery or connection with you is the problem, and this needs to change rather than seeing me as a problem that needs to change. Be aware that I have a strong inner critic, so positive feedback is really important to help balance this out. Answer the questions I ask rather than the reason you think I'm asking the question. Open the discussion about reasonable adjustments with me rather than me having to do so with you. If I say that I have trouble completing forms, then please don't give me a form to complete in order to access a service or support. Offer alternative methods of booking and changing appointments if your usual practice is a barrier to me. Listen to what I am saying, even if the way I'm saying it feels confusing to you. Offer me a longer appointment so I have more time to process any information, manage my anxiety comfortably, and communicate. Give me a video showing me where I need to go when I get to the hospital, including the kinds of people that I will be speaking to. Talk me through every step of my procedure before it happens. Ask my permission to do something to me. Don't ambush me thinking that you are helping me to get on with it. Acknowledge that I may have a different pain threshold or respond to anaesthetic differently to others. Let me wait in a quieter area or outside and phone me when it's my turn.
Check out our preferred communication style, as talking with professionals can be very difficult. I often fail to get across what I want to say. Writing or using AAC can make it a lot easier.
Hi, I'm Shiloh, and I find it useful when I go to appointments when the person allows me the time to process the information that they're giving me, and they give me time to ask questions as well. I also find it useful to be able to have my headphones on, especially if it's in an environment which is particularly loud, or if there's lots of background noises like beeping and things like that, because then it builds up. So if I have my headphones on, it makes it easier to be able to engage. I also find it useful. I find it useful when afterwards I'm able to either get a report of what was said, or we go back through what was said, so that I am able to understand and process further what I was told, because sometimes there's so much information given and so much information I have to give. I'm not always taking the information in, and I find when I walk away from the appointment, sometimes I can't remember. So if I'm able to have a report, or if I'm able to at that end be able to either ask questions or go back through step by step what we have done, and that goes into the other point where I find it easier when it's specific, like if there's a set of instructions that need to be said to me, that it's broken down, and we don't talk about a load of different topics at once, because sometimes that can be very overwhelming.
Hello, my name's Philip and I'm an autistic adult, and today I'm going to share 3 things that I wish the NHS would do more of to make things a little bit more accommodating for people like myself. 1, easy to read format with things like letters, correspondence, information regarding surgeries or procedures, and booklets that may be useful for me as part of my health plan. 2, processing time to help me with my autism. When I'm in a situation where I'm in a room with a specialist or a GP or a nurse, sometimes my brain will go completely blank and I can't process anything you've just said to me. 3, things regarding correspondences. So ideally this would be great in terms of estimated timelines. So for example, if I went to a surgery, it'd be nice to know roughly how long to wait for my results.
My biggest concern at the moment in accessing medical services through the NHS and through private services is that since July 2020, it has been assumed, or an assumption, that a person accessing these services will cover their nose and mouth in indoor spaces and some outdoor settings as well. And this has caused me a great deal of distress due to firstly the autism spectrum condition, but also a physical problem I have as a result of an accident where I can't walk properly any longer in recovery, tired very quickly as a result of that. This led me to contact somebody who got a letter for me last October from the Department of Health and Social Care, which I'd just like to read a line to you from it, where it says, some people are exempt from wearing the face covering, including children under the age of 11 and those unable to wear them due to health, age, equality or disability reasons. People do not need to prove they are exempt and they should not be challenged about this. Therefore, Mr. Disabled should not feel uncomfortable to go about his normal routine, and nobody should feel intimidated into going about their normal business, as this letter states.
Please believe us when we say something is difficult to do. Professionals regularly downplay my difficulties or don't believe me. This in turn makes my mental health issues far worse.